The Queen's Jewish Link presents the Jewish Living Podcast, the show that examines the many facets of Orthodox Jewish life. Here's your host, Izzo Zwirin.
Here on the Jewish Living Podcast, we're not going to shy away from uncomfortable topics. That's why for the next 2 weeks, we would like to take a look at one of the silent issues of our time, addiction. When we think of addiction, we commonly think of drugs or alcohol, but the truth is that addiction can be linked to any behavior. Of course, there's substance addiction, but other forms can include gambling and food. Many of us may be familiar with work addiction, but we may not be familiar with more modern addictions such as internet, smartphones, even video games. Of course, these issues exist in every community, but today, on the Jewish Living Podcast, we will discuss their effects on the Frum world. That's why I invited Shimmy Feintuch, who is I'm going to let him tell you.
My name is Shimmy Feintuch. I'm a licensed clinical social worker and, get ready for this, credentialed alcoholism and substance abuse counselor with a additional specialty in gambling addiction, which translates into a whole bunch of alphabet soup, LCSW CASE-ACG. I'm a psychotherapist in New York City. I have an office in Washington Heights and in Midwood, Brooklyn. And I teach at Turo's Graduate School of Psychology.
All right, let's get into the issue that we're talking about today, which is addiction in the Orthodox Jewish community. Before we do that, can we have a background on addiction? What is addiction? How prevalent is it? And what are the different types of addictions that exist?
So there are a lot of different ways to define addiction. A definition that I really like is continued use despite adverse consequences. So continuing to do something even though you're suffering. So you can be addicted really to anything, a substance or a behavior. So alcohol is probably the first addiction to get publicly treated or to hopefully move toward destigmatization with the advent of Alcoholics Anonymous in 1935. Continuing to use alcohol despite consequences like your spouse getting really mad at you or a hangover or missing a work appointment, right? Continuing to go back to that substance would probably put someone on the spectrum of addiction. So you can be addicted to really any substance, think any kind of drug, certainly marijuana. You can also be addicted to behaviors. So the way that this works in the brain is a little different. I guess it's probably beyond the scope of our conversation today.
Yeah, a little bit.
Although very interesting. But we can get addicted to things like gambling, shopping, treating some people with a bona fide smartphone addiction. So it can really be anything that will hook you in, continuing to use it despite consequences.
So I believe that a lot of our listeners might hear that one thing that you just said about smartphone addiction, and they're wondering, do I have a smartphone addiction? Because we're all on our phones all the time. Mm-hmm. So my question to you is, what diagnoses somebody with a smartphone addiction as opposed to somebody who just uses their phone a lot?
So that's an interesting question. As far as diagnosis, there is no diagnosis that is addiction. There's no, if you look in the diagnosis manual, ICD-10 codes, any of that, there's no such thing as addiction. You find something called use disorders. And they can be on a spectrum of mild, moderate, and severe. I tell my clients it's not my job to tell you if you have an addiction. It's my job to help you explore that question for yourself. There are some interesting studies of self-identification with an addiction. So it is subjective. I think we do need to say that. But I would pose this question to any listener. Do you use a substance or do you engage in a behavior that causes you distress? And if it causes you distress, it's something to look at. Okay.
And what would be the prevalence of addiction?
So I don't have good numbers for you. I certainly don't have numbers for the Orthodox Jewish population. So I can't tell you a percentage. What I can tell you is that it is either increasing in prevalence, or there's become less stigma and people are getting more help. So it's kind of hard to suss out. I would say that if you're living in an Orthodox Jewish community, you know someone who has an addiction. You may not know which person it is because they will probably be pretty private about it, but I can guarantee you that you do. You know someone who has an addiction.
Is that true of the Orthodox Jewish world, or is that true of any community?
I would say it's true of any community. It's widespread enough that unless you're a hermit, you know somebody who has an addiction.
My next question to you is, how can a habit turn to dependence?
I think about this in terms of a continuum of use, right? So think about a line, and on one end of the line, there's no use, right? And I've demonstrated this with clients, right? So I'm standing, and there's a chair. I am at no use of the chair. I'm not using the chair, right? Now I'm sitting on the chair. I'm a little bit further down the line. We call that use of the chair, right? Now, let's say I'm sitting on the chair in kind of an awkward way that is maybe not so great for the chair, and maybe it'll cause some more strain. I would call that misuse of the chair. And now let's say I kind of stand up on the chair and start stomping on it. We could call that abuse of the chair. So there's this real continuum of use. I'm not sure where habit would fit into that continuum, but somewhere along the way, if someone's habituated to something, that means that there's some kind of either physical or psychological dependence, right? So if I am in the habit of brushing my teeth when I wake up, that means my brain has formed an association with waking up, going to the bathroom, pulling out the toothbrush and toothpaste. So that's fine. Nothing wrong with that. If it's an unhealthy habit, like I wake up at 2 a.m. to go to the bathroom and I go to the fridge and eat peanut butter and crackers, right? So maybe that's not so healthy. So I formed an unhealthy habit. So dependence is that if I don't have it, I experience something called withdrawal. So that there's some kind of physical and or psychological effect that happens when I don't use the substance or do this behavior. So for example, many of us who use coffee have a dependence on coffee. Now, that doesn't necessarily mean we're addicted to coffee, but if we don't have a coffee, let's say on a fast day or something, and we feel that lack of caffeine, then we have a caffeine dependence.
You mentioned different ways of using the chair incorrectly. So if I'm sitting a little bit off to the side of it, if I'm standing around and jumping on it, that would be abuse. If I'm sitting on it in the way that it's intended, that could be, I guess it's regular use. At what point does that get into dependence? If I don't get up off of the chair, is that how this works? And if we would extend that metaphor a little bit further?
Yeah, so dependence doesn't depend on the chair, it depends on me. Right? So if I'm relying on the chair in a way that's unhelpful for me, such that when I get up from the chair, I start to ache, or I'm not getting enough exercise, then maybe I'm dependent on the chair. The chair is fine. The chair doesn't care, right? But I'm becoming dependent on it.
Talk about the difference between a behavioral/mental health issue and a physical/medical issue.
They're very, very similar, but they're not treated that way. I read an article a long time ago, and the title of the article was, "When your daughter has an addiction, no one brings dinner." No one brings dinner when your daughter has an addiction. So there was a story about a family who, one of their children had cancer. And there was a meal train, and everybody was organizing all these wonderful things for the family, vacations and rides to the hospital, and of course, all the meals. But then one of their children developed an addiction and had to go off to rehab. And everybody just kind of looked at them funny, passing by in the supermarket, just kind of looking them up and down, Who are they? Are they okay? What's going on? Nobody's bringing dinner. Nobody's organizing rides to a treatment center. No one's sponsoring trips to Disneyland. So we look at it differently. We absolutely do. And the question is, and I think the question we need to ask ourselves is, should we?
Do you think that possibly one of the reasons for that is that people look at addiction as something that the person suffering brought on themselves versus something that they contracted, not necessarily due to any fault of their own?
Mm-hmm. Absolutely. Right. So there's this, they call that the moral argument, right? You started drinking alcohol and you ended up an alcoholic, so you did it to yourself, right? And that comes along with moral kind of arguments like, if you really cared about your family, you would stop drinking. Or if you really valued your finances, you would stop gambling, right? Or if if your parents would have taught you better, they would, you would know not to shop the way you're shopping, or, who knows what. There's a lot of judgment, and we as human beings are very easily judgmental. No one's going to say, oh, well, you got the flu because you were lazy. Right? Or, a bit of an overlap here is in diabetes, right? Where people kind of say that, like, oh, well, you gave yourself diabetes. You shouldn't have eaten the way you were eating the past 20 years. So there is some kind of overlap. The more that I do this work, though, the more that I realize that things are really, really complex. Because sure, that one time that you had that drink when you were 13 at your friend's bar mitzvah or at a Shabbos table or on Purim, you had the drink and that affected you to go and become an alcoholic because the alcohol lit up your brain in a way that it didn't the other 5 people who had the shot of whiskey. So there's something there that's really deeper than any of us understand. It's very easy for us to moralize and say, well, you did something wrong and you brought this upon yourself. But the more, I would really encourage you all listening to study, to ask people who have an addiction. And if you don't know someone who has an addiction, go find one. Go to an event put out by Amudim and listen to somebody's story. And then you go over to them and you tell them, I think you brought this on yourself. I don't think you'll go say that. I don't think you will. Because actually listening to someone's story and listening to the pain and listening to how they were really just minding their own business and experimented a little here and a little there, and before they knew it, they were in a hole that was larger than they ever thought it would be.
What are the stigmas surrounding addiction?
So it's a lot of the same. It's a lot of moralizing. I'm just using that word, but it's a lot of, if we want to use the Torah phrase, it's a lot of not being dan l'kaf zechut, right? Not judging people favorably. We just kind of naturally find ourselves in that mindset. So what happens is, I don't want to say that I have an addiction because what will you think about me? I don't want to say that I have an addiction because will I be able to get married? Or if I'm married, will my siblings be able to get married? Or if my siblings are married, what about my kids or grandkids or great-great-great-great-great-grandkids, right? So there's an endless amount of fear that we all have for what kind of repercussions, what kind of judgment are other people going to have? What kind of things are people going to say about us? About a third of my clients are spouses and parents of people with addictions. So family members. And a lot of the work is, how can I get to a place where I just care less about what other people think? People say, hey, where's Shmuley? I haven't seen him around for a while. I'm not going to say, oh, well, actually, he's in rehab, right? It's an uncomfortable thing. Whereas if I was saying, oh, he's actually away in Cincinnati getting cancer treatment, there's something that's kind of more acceptable. Like you said, the physical medical pieces are more acceptable.
So it's even in a family member where they have that stigma, where they don't want to really admit that they have a relative with some sort of an addiction issue, as opposed to if they have a relative with a medical issue.
Yeah. I mean, I can't tell you, and this is a sad thing, but I can't tell you how many shivas I've been to where the person died from an addiction-related thing, and the family makes up a story. And I'm not talking about the need for privacy, because I don't think there's a mitzvah to broadcast, one way or another. So people may feel differently, but there's so much shame, and people are so afraid of what people will think that they create stories, and maybe easy for me to say because I'm not in a position to make that decision, thank God, but we don't get to learn. We don't get to learn from that situation.
Is there a difference between the way the Orthodox Jewish world views addiction and the way that the secular world views addiction?
I think there is. Someone, I don't remember where I heard this, but someone once said that the Orthodox Jewish world is about 20 years behind the secular world in terms of things like this. And I think that is accurate. So if we look, 20 years ago, the kind of misinformation that we had about drugs, and what comes to mind is Nancy Reagan's very well-meaning but poorly informed campaign of just say no to drugs, right? I think we have a lot of people in the Orthodox Jewish community who take that tack, just say no, right? Why would you want to, someone said this to me last week, well, why would you want to take that into your body? Why would you want to do that? And then even worse, why would you want to be an addict? Which is, come on. It's the height of ignorance. Sometimes we need to think about what we're saying. And if you're somebody who has that kind of thought, then I would encourage you to think, of course, nobody wants to become an addict, and nobody wants to get hooked on a substance or a behavior. But you obviously can't just say no. Just say no doesn't work. Because if you're hooked on something, it's a lot easier to just say yes.
I would generally offer that same question to people who are trying to go on a diet. They feel that they're overweight. They feel like they need to lose a few pounds, or maybe more than a few, and they decide, I'm going to go on a diet. And then they get the shul that week, and they see the kiddush, and they see the kugel and the potato and the cholent, and they eat the potato kugel, and they eat the cholent, and they have a soda, and they have a shot. And then later on, Motzei Shabbos, they will have pizza, and diet's out the window in one day.
And now talk about moralizing, right? Because what words do people use when they say, when they describe their own behavior? I was good today. I was bad today. Ugh, I'm so bad. I shouldn't be eating this, as they're eating it, right? So besides for the fact that you're not enjoying the kugel, right? There's that real moralizing, and we do it to ourselves, and now we just do it to others. I'm good because I did this. I'm bad because I did that. And we translate that into addiction. It's very, very hard to give other people the benefit of the doubt if we're not giving ourselves the benefit of the doubt. So what I would say to that is there's obviously more to the picture. If you commit to, I think diet's a great example. If you commit to a diet or to a food plan, and then you find yourself somehow not sticking to it, there's got to be more than I'm bad. Give yourself some more credit. Food is really the only vice that Orthodox Jews are allowed to partake in. So one example that I use is people are not going to say, let me tell you how much alcohol I had last night. I must have finished about 3 bottles of Johnny Walker on my own, right? No one's going to say that. But what you will hear every single day or every single Shabbos is, let me tell you about that kiddush. There was this and there was that, and I packed it in. I can't eat for days. So there's almost like this bragging that goes on with food. It's it's kind of like the only okay, quote unquote, addiction.
So what I hear you saying regarding addiction in the Orthodox world is that there's a couple of areas where we are different than the ways that the rest of the country or the rest of the world would view it. We have the component where people are afraid of their families, their shidduchim aspects, their prospects for shidduchim. Mm-hmm. We are afraid of certain behaviors, but not other behaviors. Mm-hmm. And we glorify certain behaviors while shunning other behaviors that could just easily be as addictive. Is this different than the secular world? Or do you think that the rest of the country and the rest of the world has similar views on addiction? And if so, why or why not?
I think a lot of the ways that we're looking at things are similar. Where I think that we're different is maybe the level of acceptance and the level of stigma. I do think that the secular world is probably about 20 years ahead of us in terms of education about addiction, being able to talk openly about addiction in schools and in community centers, and in stigma as far as, oh yeah, like someone in my family has an addiction. I think, nothing is across the board, right? I don't want to stereotype in that way, but the Orthodox Jewish community is behind in that way. We're less likely to be able to talk openly about an addiction in the family, or someone that we know, certainly an addiction that we have personally.
Let's talk about more practical applications.
Mm-hmm.
So, what signs might become noticeable should someone start becoming dependent on a behavior or a substance? So, things that individuals could look for about themselves and things that people can look for in others.
So for the layperson, right, we're not talking about a professional. We're talking about, I'm looking at my own behavior and I'm looking at, let's say, behavior of family members, friends, that kind of thing.
Exactly.
Yeah. So a lot of things will be similar to that of mental health issues. But you definitely want to look at different aspects of people's lives. You want to look at their ability to function. So if someone has always been able to get up in the morning and then you find that they're not able to get up in the morning, we're looking for a change. We're not looking at the person who has never been able to get up in the morning. Maybe that's something else. But we're looking for a change happening. We're looking at people becoming more secretive about their life. Where were you? None of your business, right? Or where were you? And then they say some kind of story that doesn't make very much sense. So people getting slippery in that way. People who were social kind of withdrawing. I had a friend who, when he was doing well, he would respond to the friend WhatsApp group, and when he was not doing well, would kind of withdraw. So that was kind of a giveaway. So we just want to look at different things that we can call red flags, right? So definitely anything that has to do with changes in mood, changes in social behavior, changes in secrecy, definitely doing anything that seems more impulsive or dangerous. The person started hanging out in a bad neighborhood all the time. Well, why are you doing that, right? Maybe they're trying to get drugs or something. All of a sudden, they find a need to go to Atlantic City every weekend. Why? Because I like the hotels there. No one likes the hotels in Atlantic City, right? So those kind of things, any kind of suspicious behavior. And as far as personally, as far as noticing things in ourselves, there are some really basic and powerful defense mechanisms that our psyche, that our brain creates. And it can be hard for us to see that on our own. Those things are denial and rationalization. Denial is where we deny that something exists. I'm not doing that. I never did that. That's not true. It didn't happen. Where we kind of block something out. Like, oh, sure, I did that, but I'm just not going to think about that ever again until the next time I do that. Right? So that happens a lot. And rationalization. I earned it. I had a hard day. I need the alcohol. Or, I earned a lot of money. I can go gamble it away. Or, fill in the blank. Really anything like that. So we make these rationalizations all the time. I would say if you have any kind of question, if you're in any kind of situation where you're experiencing consequences, remember that definition, continued use despite adverse consequences. So you're experiencing consequences and yet you continue to go back to a substance or behavior, ask somebody. There are so many hotlines. You give Amudim a call, give me a call. Just ask a question. Ask a friend, hey, does this seem normal to you? One thing, and then maybe we'll get to this when we talk about treatment and getting better, but one of the things that is really so important is the social aspect, getting help from other people. I think about addiction as like a 2-ton beam. You try to carry it on your own, you'll get crushed. Nobody can do it alone. But if you have a group of people, you have a support system, and everybody's carrying their part, you have a fighting chance.
We've talked a lot about behaviors that are generally looked at as negative. So alcoholism, drug use, gambling. What about behaviors that are generally considered to be good uses of time? So something like exercise. So people are generally not exercising enough. Or reading. People are generally not reading enough. Is it possible that those things, that those behaviors are addicting? Can somebody become addicted to those things? And if they are, is that more difficult to get out of, or is that a less stigmatized area?
That's an interesting question. I haven't heard of people being addicted to reading. What was the other example?
Exercise.
Exercise.
In America, probably exercise addiction is probably very low.
So I think exercise needs to be in its own category, because the people who are quote unquote addicted to exercise generally have an eating disorder, meaning that it's actually a form of purging. They call it a compensatory behavior. So I would kind of put that in a separate category. But let's say something like reading, or I don't know what, anything.
Let's say learning Torah.
Learning, ooh.
There goes our ratings. There goes all of our sponsors.
They said don't learn Torah. So I don't think that they're, the word that I would use is sticky. I don't think that they're sticky enough to hook people in. We got to do some neurology, Izzo. We got to do it a little bit. Bear with me.
Go ahead.
So a little bit of how we learn and how we get hooked on things is with a chemical in the brain called dopamine. It's basically the feel-good chemical. Think about dopamine as the fish that the trainers in the aquarium give to the seals. You do something good, you get a fish. You poke the beach ball with your nose, you get a fish. You do the hoop thing, you get a fish. So every time that the body does something that the brain likes, the brain gives the body a fish in the form of a little spurt of dopamine, which feels good, right? So you have a piece of cake. The brain says, ooh, I like this. Please remember where you got this cake, and we'll mark the spot with a little bit of dopamine. You'll feel good, and that'll actually help you remember it. One way, just as an example, one thing that triggers dopamine release is novelty, things that are new. Now, where do we have an endless source of novelty?
I would say the internet.
Yeah. For the first time in the history of the world, we suddenly have access to an endless amount of novelty. So this is where smartphone addiction comes in. You're not addicted to the device. You're addicted to the novelty. You're addicted to the endless scroll of Instagram. So you're constantly getting that dopamine hit, and that'll suck you in. Every kind of addictive substance or behavior has a kind of hook like that. So gambling, right? The chance of winning is a real is something that creates that chemical reaction in the brain. Food, right? It is a chemical, right? Chemicals, right? You're eating something, and that if it tastes good, you'll also trigger that dopamine reaction, and your body will like the sensation of the food that you're eating. If it's a drug, if it's an addictive drug, then there's that physiological process.
So let's talk about gambling in that regard. Is the dopamine released from the rush of gambling, or is it released from the winning of gambling?
So the first experience is important, meaning if someone gambles for, I don't know what, the first 10 years of their life and they don't win at all, they probably won't develop a gambling addiction, even if they have a predisposition to it. It's possible, but unlikely. When people form that association with winning, then what happens is when they start to gamble, even before the decision has been made about if they're going to win or lose, they already get the rush. It's in the behavior. This is called ritualization, right? People thumbing through their phone to get to their dealer, or if they're on the way to the alcohol store or on the way to the bodega to get the lottery ticket, already start to feel the rush. It's very detached from winning or losing.
Let's talk about the ways to handle an addiction, because I think that's one of the key areas of this. Mm-hmm. I'll turn it over to you. Ways that people can seek help for addiction, ways that people can encourage others who they think have a problem to go for help.
Okay, so that's an important question, and those are two very, very different categories of things. When someone calls me and says, I think I may have an addiction, that's great. I say, you came to the right place. Let's make an appointment. I'll do an assessment. I'll tell you what I think, and we'll try to arrive at a treatment plan. So if you think that you might have an addiction, or what you want to call it compulsive behavior, or even a little bit more watered down than that, you're doing something and you're experiencing consequences and you continue to do it and you think you may have a problem, go to an addiction specialist. Don't go to any old therapist. Go to an addiction specialist. Google is your friend here, right? Just ask for addiction specialists. You can look on Psychology Today. If you're looking in the Orthodox Jewish community, you can call Relief, which is a referral agency. There are a lot of really great referral agencies. Amudim is another one. Yeah, so there are referral agencies, and they do have national and international contacts. So even if you don't live in, Orthodox Jew Central in the tri-state area of New York, New Jersey, and Connecticut, you're still covered. So that's I think it's really important to get an evaluation, to get somebody who knows what they're talking about and can direct you to what we call an appropriate level of care. Do you need rehab? Do you just need to talk to a therapist once a week? Do you need group therapy? There are a lot of different pieces to it, but getting in the door of somebody who's a specialist is really important. Now, what happens way more often than someone calling me and saying, I have a problem, is someone saying, my spouse has a problem, my child has a problem. So I'll get a call from somebody like that, and they'll say, help me with this other person. So that's when it gets a little complicated. There is something called an intervention, and it doesn't really look like most things that you've seen on TV, and it requires someone who's actually skilled in performing an intervention, where the therapist will meet with all the people who are involved and kind of are stakeholders in this, they call them the IP, the identified patient's life, and we'll prepare a meeting where this person will come and people will kind of read letters and say, I'm concerned about your behavior because of this and because of that. And it may or may not include a consequence like, we really need you to get help. And if you don't, X, Y, and Z. And it'll always include an offer to get help and a plane ticket. if that's relevant. We want you to get help. We have a bed for you in this treatment center. Your flight leaves in 3 hours. So that's an option. That's called an intervention. More likely, what I'll say is if it's, let's say a parent, I'll say, why don't you come in and I'll talk with you about how you can use your leverage to help your loved one, right? Or I'll talk about, you as the spouse can come in. Because if the person themselves, if the identified patient doesn't want to come in, there's not a lot that you can do. So the work very often is with the family members, to help them help themselves. Because if you're so focused on the other person's thing, you often forget about your own stuff. And then, like I said, to kind of use your leverage, to kind of say, all right, well, maybe stop giving this person $200 in cash every week. Right, and you don't have to pay for their Uber anymore. And, can we work on setting a curfew? That kind, if it's a child. They say in Al-Anon, which is the 12-step group for family members and friends of people with alcoholism, they say, put your oxygen mask on yourself before your loved one, before your child, like they say on the plane.
So as we mentioned earlier in this conversation, there is definitely a stigma of addiction or against addiction in the Orthodox world. Do you think that this causes from people to be less likely to seek out help, even if it's not for themselves, if it's for somebody else? Is that something that people keep in mind? And if so, what can we do to destigmatize at least the searching out for help?
I absolutely do think that the stigma prevents some people from getting help, particularly among women. There's, part of the stigma or the false reality that we create is that Jewish men can kind of go off and have their fun and then, get their stuff back together and get married and settle down. But if women do that, they're bad in some way, or ruined, if you want to say that. What a terrible thing to say. But I think there is that kind of stigma. So I see that among women in general. People, women with potential addictions find it hard to get help. As far as what there is to do, it's a toughie. I mean, I think on the communal level, there are a lot of organizations that are helping. Again, organizations like Amudim. I mean, there are a ton of events, at least every month, where they're talking about community awareness. And I think eventually, awareness kind of seeps in, and we are slowly combating stigma. But perhaps on a personal level, we can be careful about the way that we talk about things we don't understand. And we can be careful about saying, oh, someone's doing that, that's so gross. Or someone's getting drunk, they're so irresponsible. Or, just to watch the language that we use, to watch the judgment, and maybe to add some understanding and say, maybe that person's in some kind of pain. Maybe they need help.
Shimmy Feintuch, thank you very much for joining us. If people have any questions, where can they reach you?
So I'll give you my website and my Instagram. Website is shimmyfeintuch.com. I'll spell that for you. ShimmyFeintuch.com. And my Instagram is shimmyfeintuch.lcsw.ksac.g, which is a lot of letters.
And for people who are looking on more information, or you mentioned a number of organizations, where can they look for that?
So for mental health referrals and addiction referrals, check out Relief. That's reliefhelp.org, RELIEFHELP.org. And Amudim is another wonderful organization. Amudim.org, that's AMUDIM.org.
Okay. Once again, thank you very much, Shimmy Feintuch.
Thank you.
I followed Shimmy's recommendation of reaching out to Amudim, and they were able to provide me with some addiction statistics on the Frum world. Of the over 1,100 cases of addiction they have dealt with, 67% are related to street drug use. Other categories with high representation are alcohol, prescription drugs, and sex addiction. Amudim's website is amudim.org. The full list of types of addiction broken down by prevalence can be viewed on all of our social media pages. Next week on the Jewish Living Podcast, we look at an addiction from a different angle. We sit down with someone who went through his own battle with addiction and his path to recovery. For now, have a good week. Kol Tov.
The Jewish Living Podcast is produced by Swirly Pikus. Our theme song is The Band by A.B. Rottenberg from Journeys 4. You can email the show at jewishlivingpodcast@gmail.com. You can also find us on Twitter at Jewish_living. The Jewish Living Podcast is recorded in conjunction with the Queen's Jewish Link.